Circulation is really important. Yeah, there's a saying that stasis is the basis of disease. So and it basically means that if things aren't moving in your body, you do get disease can happen for a whole range of reasons. And even just, for example, in the abdomen, there's mesentery. There's all these areas where fluid can collect, and if that just stays there, which it often does, then there's bacteria can grow in that area and become quite putrid, and you become quite ill. So the movement's important. And one of the ways chiropractic helps that, or exercise helps that. The massage chairs help that as well. The massage chairs are useful in getting movement, but circulation is very important. It's also very important in terms of nutrition to different parts of the body, joints in particular. If you have cartilage surfaces and discs lose their blood supply at a very early age, like everyone's disc at the age of 25 loses its blood supply, and it doesn't matter whether you're healthy or fit or what you are, you just lose that blood supply. So there's not much nutrition, you don't get nutrition to the disc very well, you don't take waste products away from the disc very easily either. So if you can get circulation in there and through various means, then that is very important for the health of the disc. And exercise is important with that, chiropractic is important with that, and the massage chair is very important with that, because that vibration actually improves circulation, actually gets fluid flow in and also fluid flow out of the disc, which and there's pretty much no other way of getting nutrients in and out of a disc other than through movement and vibration. So we use the massage chair a number of ways in the practice. We have not quite a joke, but we often say that as chiropractors we do the panel beating and the massage chair does the polishing. So that's one way we use it, but it's very good from a relaxing point of view. So patients can relax on there, and sometimes if people are in a tense state, their treatment doesn't work as well. So it's good from that point of view. We use it from the point of view that when we do other therapies, like if we use magnetic pulse therapy, that's a good place for them to rest while they're having that therapy done. And we use it as a way of relaxing muscles after treatment, because even though we sort of make fun of the fact that we do the panel beating, sometimes people are a bit sore after a treatment. That's not unusual. And the massage chair just actually gives the muscles a chance to relax and gets the circulation going, and the muscles relax, the patient relax, and we get a better result because of that. Circulation is very important to health in lots of ways. From a chiropractic point of view, it's very important because you often hear of people who say, in winter my arthritis is worse or my joints are worse, and that often relates to circulation, because if you have a good blood supply to an area, you have less pain in that area, because lack of oxygen actually hurts. So if you're having oxygen and circulation, or in this case blood supply which brings oxygen, if you have lack of oxygen to a joint or to a muscle, that's just simply going to hurt. The body aches when it's got lack of oxygen. So if you can improve the circulation, then people are much more comfortable. They're also a lot healthier as well, because the purpose of circulation is to bring nutrients into an area and take waste products away. So if you can improve the circulation, health improves. And for a lot of people, there's a lot of people do sedentary work. They spend a lot of time sitting at desks. They don't do as much physical work. They don't do as much exercise. They spend a lot of time on computers, either for work or recreationally, and that is a health issue. And part of the problem it creates is poor circulation. If you don't move, joints do lock up. It's quite common people experience that situation where they wake up in the morning and they're really stiff, they can't move. And that has a lot to do with the fact that overnight in the joint there's a lubricant that's called synovial fluid. And as you move, you stimulate the release of synovial fluid. When you're not moving, that tends to dry out, and that's why you wake up in the morning like your joints need some grease in them. So that synovial fluid's an important part of keeping your joints healthy and also keeping them mobile and pain-free. So if you can move or get circulation in there, that improves them in a lot of ways. Yeah, a massage chair like the one we're talking about would make a big difference to someone with arthritis. See, arthritis, you can't really cure arthritis as such, but you can do a lot to manage it. From exercise, nutrition, etc. But if you can improve circulation, then people who suffer from arthritis are much more comfortable if they have an improvement in circulation. That makes a big difference to their health and makes a big difference to their comfort level. And again, it's obvious people go to Queensland in the middle of winter and their aches and joints are better. And it's partly the heat, and the heat causes improvement in circulation, and that's the benefit of getting circulation going through the body. Because if you're not when you've got circulation going through the body, you bring oxygen to the area, you bring nutrients to the area, and you have much less pain and a much healthier joint and body generally. As people get older, mobility is a really big issue in lots of ways. When you're not mobile, it affects you in lots of levels. I mean, even in terms of self-esteem, not being able to get in and out of a car and go shopping on your own, mobility is really important. And also mobility, a lot of elderly people fall, and falls are a big problem with older people, especially with osteoporosis. And if your joints are more mobile and you're more flexible, then if you're about to fall, you can stop yourself, you can put that leg out or that arm out and stop yourself from doing that. If you don't have that mobility and that flexibility, then you're more likely to fall. And this is not directly related to the chair, but I mean, it's important that older people do exercise and develop some level of strength and flexibility for a lot of reasons, including reducing their chances of falling or recovering better if they're about to fall. If people are mobile and they're not in as much pain and they're able to do things, that has a lot of flow-on effects, because if they have that confidence and they're pain-free, they can go out and do things, and then it has if you're doing things, then you're going to be more healthy and feel better, and then you're going to do more things, and that sort of thing flows. Whereas the other way around, if you're in pain and feeling sorry for yourself and not moving, you move less. The less you move, the less you're able to move, and eventually that spirals back the other way. So that self-esteem and that confidence that comes with moving and being pain-free is a really important part of health. It is a spiraling issue. Yeah, it's like if you don't push the boundaries close in on you, and so it's important to keep mobile, keep active. But if you're in pain and things are hurting you, then you're not going to be as mobile and not going to be as active, and the less active you are, the less active you're able to be, and it slowly becomes worse. Whereas if you just push the boundaries a bit and you find you can do things, even if you put up a little bit of discomfort, you find your confidence builds up, your mobility builds up, and you start doing more, and your health improves. Yeah, movement is really important to health. People underestimate how important movement is to health. Yeah, we have an advanced lifestyle massage chair, and we have patients asking us all the time patients love them. They absolutely love them, and they're always saying, if I win a lottery, I'll get one. And they're always asking where we get one from and what the cost, etc. So, if they were to ask me whether it's good to have one at home, it's definitely good to have one at home, because, as I said, we can only treat them for a few minutes, once a month, once a fortnight, once a week, or whatever, when they come in. If they have one at home themselves, then they can have access to those benefits on a daily basis, even more than once a day. So that it's certainly something I recommend. And I mean, they really do love it. People come in. I think they come in just for the massage chair half the time, actually. So people often fall asleep in the massage chair, and we say that's quite okay as long as you don't snore, because then you get 20 cents in the cookie jar. Well, I think the benefits of having it in your own home is that, see, one of the things that happens when patients come in here is that we see them initially perhaps once or twice a week, and then less often as time goes by. But they're only here for a short period of time. So health has got a lot to do with taking responsibility. You have to take responsibility for your own health, basically, and that which you can do at a lot of levels, whether it's nutrition, what you eat, the people you associate with, exercise, etc. So having a chair at home means that it's not something you do once a month or once a fortnight when you see your chiropractor. It's something you can have at home and do on a regular basis. So that's the benefit, that they have that. They have access to something which is a benefit to their health at home, which they can use any time that they want to.